Good afternoon and welcome to everyone in attendance today. My name is Jeremy Kaufman and I'll be introducing this installment of Tetra Tech's COVID-19 live event webinar series. Today's topic is COVID-19 hurricane planning implications. As we get started, you can send troubleshooting questions to the Q&A tab in the upper right-hand portion of your screen. Hopefully we can address most technical questions early on with that tab. If you're having any trouble with your audio, please check the volume on your local device. Sometimes it's as simple as boosting the volume on that. We will also be collecting questions throughout the day. You can populate that also using the Q&A tab as we're going through the presentation. We anticipate a lot of questions on this topic, so remember to include your name and email so that we can get back to you directly after the presentation. I'm pleased to introduce today our host. Ms. Ann Cabrera has been one of Tetra Tech's thought leaders in post-disaster services for 15 years. She's the Deputy Director of Post-Disaster Programs and has worked nationwide on numerous activations since Hurricane Katrina in 2005. She served in a variety of roles and has worked on reimbursement for more than $4 billion for FEMA. Since then, Ms. Cabrera has worked on behalf of state and local governments nationwide and is one of our disaster recovery experts. Ann, welcome to today's webinar.
Thank you so much, Jeremy. Very much appreciated. So I just want to start by saying, we do a lot of these. I've worked for, and I'm sure some of the state and local government communities we work for are on the webinar today. And we always this time of year are thinking about hurricane season and planning for hurricane season. And this is the time when we dust off those plans and think about next steps and make sure that all our new staff members are trained. But this year's particularly challenging. We've never been through a hurricane season before where we've been dealing with a global pandemic. And that definitely means that there are additional considerations that have to be taken into account. And so what we've done, rather than hear from me, is we've invited several of our public sector representatives, Francisco Sanchez from Harris County, Texas. He's the Deputy Emergency Management Coordinator there. Michael Kalick from Richland County, South Carolina. He's the Emergency Manager, and Sharon Long, also from Richland County, is an emergency planner. And then Mark Wilthoff from the City of Tampa is the Director of Solid Waste for the city. And so we are going to ask each of them to give a little information and insight on some of the things they are considering. And so I am going to turn it over first to Mr. Francisco Sanchez.
Great. And thanks so much for the introduction and for the team putting this together, because this really is, the question of the day, hurricane season and COVID. I'm sure everybody's being asked that question. And it's actually the easier of the questions, because people could be asking, how do we deal with hurricane season, flood season, wildfire season, heat wave, civil unrest, and any of the number of other potential emergencies that we are likely to face in the midst of COVID. There is some good news in that it is not new to us. We have dealt with hurricane season and Zika, Hurricane Zika and H1N1, hurricane season and Ebola. That said, I do not want to minimize that COVID-19 going into this hurricane season really adds a new level of complexity. It genuinely is a critical challenge. It's different than Zika and Ebola and H1N1 by magnitude. This is the first pandemic of this magnitude in more than a century. And we're not only on the cusp of what will be a highly active hurricane season, but one that is of particular concern to the Gulf Coast, the way things are shaping up. So that said, from the emergency management side, there's a couple of issues that we are paying particular attention to here. Evacuation, ensuring, even with all the uncertainties that come with forecasts, that we order evacuations when necessary for the most precise geographic locations as possible. Again, easier said than done when the uncertainty of surge, forecast, how much time are we given, and those kinds of issues. focusing on the timely and safe evacuation of the most vulnerable, which is even more critical now. Making sure we have sufficient resources, because we will need more of those. Buses, destination points, the capacity of staff, the willingness of residents to participate in those kinds of things are elements that are going to be critical. It's going to be really a Herculean effort to integrate the city, county, regional, state, and federal plans. For context, we have issued evacuations on the assumption that destination communities are safer than those in a mandatory evacuation zone, and that where they're going is safer than where they are. When it comes to surge, that certainly is generally true, but we will have to know from day to day what is the context of COVID, where we are in the response, and that'll play a factor that simply we will have to see where we are at the time we have to issue an evacuation order. One of the things we have to discourage is evacuation for convenience. There are oftentimes folks in some of our communities that will evacuate because they are afraid of losing power, or they would rather simply not have to deal with some of the inconveniences of a storm if they are not in a critically dangerous area. We will have to discourage those. Asking people to evacuate tens of miles rather than hundreds of miles, so they stay within the community they know, and not be exposed to other communities that may be grappling with COVID in other ways, which inevitably leads to the question of sheltering. You would continue to rely on the American Red Cross as our core partner for sheltering. And we know they are taking a very robust approach, working with guidance from the CDC, and they have a national plan as to how that will roll out at the local level. In short, we're supportive of that, prioritizing non-congregate settings, whether it is dormitories, hotel rooms, campsites. But we have to understand that the congregate shelter, bringing various people under one roof, is inevitable. That's simply going to happen. So they've got the planning and the training for that. Their success is going to rely on the supplies and volunteers, supplies being actually the most certain part of that. And we're working here locally to make sure they have the resources they need to be able to respond to that. Volunteers are the core of the American Red Cross response. So that remains in question. They've got folks that are willing, but we'll have to see when the time comes. And so also thinking about that as an emergency management perspective, how can we maybe surge those volunteers if that is a challenge, either because the impacts of the storm or because there's a lack of volunteers over a wide area because it could be a catastrophic event. And you have to think about also that the volunteer base for the American Red Cross, a significant portion of that tends to be in the vulnerable communities in terms of age and other issues. So that's important to keep in mind. We have to plan for mass shelters, whether we like it or not, whether it's a preference or not. We have to plan for all kinds of worst case scenarios. So those are the type of things that we're looking at on the sheltering side. The American Red Cross plan right now says they will not shelter more than 2,500. I think that's a given that it's a worst case scenario. We would not like to bring people into that kind of setting. But if we have to do that and even larger, what will we do as emergency managers to be prepared for that? Asking people to go to friends and family rather than go to a shelter or a hotel if that's not available, but also to understand that that means you still have to implement social distancing and limit the exposure. Your household likely has different exposure levels than do somebody else if they are an essential worker, if they work at a retail facility. Do they have someone vulnerable in that household? Those are the kinds of issues that you still need to plan for. Mass care and recovery, I think, are things that probably need a lot of attention that we still need to focus on. The good news on that, feeding, food distribution, healthcare, things with lines, providing services to people is something that has worked relatively well and has evolved in the COVID response. We can rely on that foundation, from the masks to the gloves to the distancing. Those plans are there. The challenge is going to be building up the capacity, and that may be a challenge. I think one thing we need to keep in mind as a big question that still has to be tackled is the issue of limited philanthropy. Because of the economy, giving is down, and let's face it, when we get a federally declared, presidentially declared disaster, that presidential declaration puts some money on the ground in people's hands. But the bulk of those dollars then come months later, 10, 11, 12 months later, that goes into the community. That gap has been filled by our nonprofit partners that are doing crisis counseling, disaster case management, unmet needs. And if those philanthropy dollars aren't there, to be that buffer between that gap and FEMA comes in initially, and then for the other dollars at the end of that, is that going to fall on us? So those are things to consider. And then recovery centers. We're working closely with our nonprofit partners to see how that might work. You know, we open disaster recovery centers. Typically the folks that go there tend to be the most vulnerable, those that are most severely impacted, and they rely on that physical interaction to get through those complex cases. And at the local level here, we supplement that presence with nonprofits, community services department, other folks that can provide additional support to those impacted people. How will we do that? Well, certainly the telephone is there, online is there for FEMA, but you know, how do we deal with those challenges of people that don't have access to that? We've seen the digital divide play out in COVID in schools and things like that. And then the role of the public is probably going to be the single most important factor in determining how successful our response to COVID is going to be. It is what they do at the individual level about wearing face coverings, social distancing, washing their hands and sanitizing. That is the most essential element no matter what we do, and that's going to be exacerbated and highlighted by responding to two disasters at once. This sounds like a daunting challenge. So the one piece of advice that I give to my colleagues across the state and my friends across the country that are grappling with these issues is this: cover as much turf as you can. Identify what your priority areas are in your jurisdiction or in your community and focus on those. For us going into this season, it is evacuation, shelter, mass care, and recovery. But in the 15 years that I've been doing emergency management, you know, I have yet to see any plan fully survive its encounter with reality. As you tackle your priority issues, my guidance and suggestion is deal with concepts of operations, go with ConOps rather than detailed plans. It allows you to focus on the priority issues and to cover more ground when planning capacity is scarce and time is scarce. And you know that each of your plans or approaches are subject to what status of COVID is at the time, and that they will give you, that gives you the flexibility and adaptability that you're going to need to succeed.
Great, thank you so much, Francisco. That's excellent advice. I especially love that, and I really for any time, you know, going with ConOps versus sticking to a written plan. That's some wonderful advice. Next, we're going to hear from Mr. Michael Kalick, who's the emergency manager from Richland County, South Carolina. Michael?
Yes, hey, good afternoon. I think Francisco stole the show. He pretty much covered a lot of stuff that all of us emergency managers are dealing with nationwide. Him being in, I'm not too sure where Harris County, Texas at, if that's inland or on the coast, but here in South Carolina, Richland County is the second or third largest county in the state, and we have the capital of South Carolina here. Columbia, South Carolina is the capital. So just to give you a little brief of South Carolina, we have probably a population of about 1.5 million people here in the state. During the tourism season, we probably have a little bit more, in excess of 2 million. We have about 187 miles of coastline. Our most popular areas is Myrtle Beach, South Carolina. I'm sure a lot of y'all heard of Myrtle Beach, Hilton Head area. Charleston, South Carolina is a famous historical area. All these coastal cities are prone to substantial hurricane damages, and we've had hurricanes in the past. As y'all know, that Hurricane Hugo was pretty devastating to South Carolina, but we've had hurricane threats quite frequently in the past few years, and already with 2 named storms this year, we actually had an almost subtropical depression form off the coast of South Carolina again yesterday. A low system that moved towards North Carolina, so luckily it didn't have time to form for anything. Already this year has been very busy on top of the COVID-19. We've had, in February, we've had massive floods in the upstate that called for a state of emergency declaration. In April, we had a huge amount of tornadoes that hit our state. And then, of course, in March, we had the pandemic, the COVID-19 startup, and to this day, we're still dealing with the COVID pandemic epidemic that's going on. But then towards the end of May, we had the protests and the riots that hit the capital city. All of our major cities in South Carolina got hit by the protests and riots. And we're still dealing with the protests currently here in South Carolina, as many cities in the nation are dealing with the same. So as the emergency manager in Richland County, I could say at least that I've been extremely busy with dealing with multiple events, and the COVID-19 just poses a threat that none of us are really geared to deal with or have done with in the past. I've been in emergency management now for over 20 years. Law enforcement, I've been in law enforcement also my first part of my career, then kind of dipped into emergency management my later half of my career. I got about 38 years of government service right now. But to talk about a little bit the COVID-19 pre-planning here in South Carolina for a hurricane event, the local municipalities and the state governments and our nonprofits or many other organizations have been involved in the planning process. The Red Cross, Salvation Army, our social service state agency, our state emergency management division. We do have a plan in place to deal with hurricane sheltering for evacuees during this pandemic event. So the state does have a con-op plan that they just drafted out just recently. I got a copy of it if anybody's interested to look at our plan in dealing with the COVID-19 hurricane operations plans. But it's pretty robust, and it's dealing with a lot of things that Francisco talked about in Texas. We're dealing with the same type of situations here as far as congregate care and non-congregate care. In South Carolina, our shelters are mainly schools that we use around the state. The Red Cross manages these shelters here for the most part, and most of our schools are the ones that we use as shelters. As far as a non-congregate care type facility, that's been a struggle here in South Carolina in dealing with non-congregate care facilities. A lot of our hotels and motels that we've designated as a non-congregate care facility, we've had them come and go with us to work with us. A lot of them, once they find out that there's possibly COVID-19 positive patients or presumptive patients, they turn their noses to our business and say, no, we can't help you guys. But we do have hotels and motels that we are currently using as non-congregate care facilities. And our plan is for the hurricane scenario, if we do have individuals that show up in our congregate care facilities that need isolation, we will refer them to a non-congregate care facility, that being mostly hotel and motels in South Carolina. The Red Cross does have a plan in pre-screening individuals coming into shelters as a screening process, and also all the shelters that we will be utilizing in a congregate care type facility will have an isolation area. If individuals show up with a fever or even a slight fever of 99, I think it's 99.5, don't quote me on that, but I think and higher, and they do have some of the symptoms, that they will be put into that isolation area of the shelter and then determine whether or not to be transported to a non-congregate care type facility, it being a hotel, motel type facility. We do have, the state is going to start pre-staging PPE for all of our shelters. I know the Red Cross is providing PPE for their shelter workers. The state of South Carolina is providing PPE for all the counties for our shelters, the pre-staging PPE kits, including masks, gloves, gowns, face shields, so forth and so forth, hand sanitizers, everything that we would need to prevent spread in these shelters here. So all that's going to be pre-staged and transported to that shelter once it's open. Evacuees will be asked to wear masks. I don't think the Red Cross is requiring them, making it mandatory, but they're highly encouraging all shelterees to wear masks. And all the shelters are going to be maintaining the 6-foot social distancing, all the protocols that are in place that the CDC recommends. There'll be a health specialist there, a safety officer, and along all with the shelter team there. I'm trying to think if there's anything else that I'm missing. But as far as our normal hurricane plan, all that's in place. I think the only really difference that we're going to notice is that once the governor declares for a mandatory evacuation of our coast, that the timeline is going to change a little bit. We're going to need more time to evacuate the population because of this COVID-19 event. Also, our sheltering capacity has dwindled down because of the social distancing involved. So our capacities have gone down. I think right now we have the potential to shelter around 6,000 individuals. That's our number that we're using to go by as far as sheltering a population. That doesn't seem like a lot, but the numbers add up. If once you get people inside these shelters area, that 6,000 is quite a bit to deal with. But that's really all I got. I don't know if Sharon Long was able to get on the phone. Sharon can talk to you more about the preparation piece on hurricanes, on what's all involved in hurricane preparations. Sharon, are you there?
Yes, I'm here. Mike Taylor covered most of it. We do have shelters in Richland County through churches who agree to house people during the hurricanes and whatnot. This year it's going to be a bit different because many of our churches and houses of worship have not reopened to their own members. So therefore we're not expecting them to want to take in people off the street or people coming from the coast because of COVID-19, and COVID-19 is going to present a problem for us with sheltering for people and their pets, because we have churches that will take folks and their pets. So that's going to be our problem this year. We're going to really depend on the Red Cross to open up their shelters.
Thanks so much, Sharon and Mike. That's great to hear about some of the things that you guys are thinking about in Richland County. And last but not least, our final guest speaker today is Mark Wilfock, who's from my home state of Florida, the city of Tampa. And Mark, I'll turn it over to you.
All right. Good afternoon, everyone. Thanks for having me on as a guest today. As far as some of the actions that we have taken, in response to the COVID-19, a lot of it's already been mentioned from some of the previous presenters. But just to give you a little background about our emergency management plan, the city of Tampa has an emergency operations center that they activated. It's always been in place as it relates to, responding to unexpected events, hurricanes, and primarily. But then also, so we have ERCs as well, which, basically is an emergency response center. We have 3 ERC centers that are strategically located throughout the city. They, because we've always planned for natural disasters like hurricanes, all of our ERCs are beyond any sort of flood map plane or any sort of flood zones that may exist within the city. And I basically like to categorize them as the first responders to, to restoring the right of ways and opening up arterials that throughout the city for, whether it be for emergency management vehicles or, emergency response vehicles that need to access assisted living facilities or hospitals or medical care facilities. Those ERCs are primarily designated for that purpose. So immediately when the wind's clear and it's safe to go out, you'll see a team of front end loaders and chainsaws and bucket trucks out there basically plowing and clearing the way, opening up those what we categorize as being, I forgot the name that we call them, but basically our main arteries that lead to critical facilities that we've identified throughout the city. Now, when, COVID came on, we actually used some of these ERCs to assist, especially in response to the civil unrest. I was actually having a conversation with one of my coworkers at the city, and was like, hey, what happens if, if this some of the riots that we're seeing throughout the nation comes to Tampa? And at that time, it wasn't the closest alligator to the boat. That was the best way it was relayed to me. Well, 10 o'clock that night, I got a call, hey, let's assemble the troops because we got a lot of cleanup work to do. And I got to tell you, I didn't have high hopes going into it. Making a phone call to gather about 30 employees 10 o'clock on a Saturday night. I just didn't have high hopes, going into it. But when I came in and put the word out to a few individuals, and when I walked in to our office and saw the team that was willing to respond, to the call, it was amazing. It truly was. But again, now we have people that are, basically trying to tear up our city. I got to get employees coordinated to come in, make sure that they're safe as well. We didn't want them to, we wanted them to be out in teams, but we didn't want them to ride together. So of course we ended up taking more vehicles than we normally would to respond to some of the civil unrest that was occurring throughout the city. But in the end, I have to say that things were successful, as far as being able to help restore calm to the city. So COVID-19 has definitely presented its challenges to us. Each year, we always run an emergency management exercise where we ask all of our commanders of each ERC to, basically test certain functions of their plans. This year was a lot different. It was a scaled down version, and we've already identified some of our needs in response to the COVID-19. For instance, we think we're going to have to order more standby generators because we can't have 50 people in one room, and I didn't mention it earlier, but whenever people get called to work at the ERCs, we ask them to bring 3 days of clothes and food and whatnot, and they're sleeping on cots, and it's traditionally, it's always been close quarters. Well, with the arrival of COVID-19, we're having to spread out more. And that means that we have to use additional wings at the ERC facilities. Now we have to think about more generators that we need in order to supply standby power and things like that. So it has definitely thrown some challenges at us, but it looks like so far the city of Tampa is definitely ready, to respond.
Thank you so much, Mark. I have no doubt that you guys are all ready to respond, no matter what challenges come your way. And you guys are really good on timing too. I have just 1 minute before the top of the hour. So I just want to say thank you to all our presenters for your insights today. For attendees, this presentation and previous COVID-19 webinars, a recording of them can be found at Tetra Tech's COVID-19 webpage. Our next webinar will be held on Wednesday, July 1st, beginning at 1:30 p.m. Eastern, and the topic will be safe buildings for COVID-19. As registered attendees for today's webinar, you will automatically receive an invite to future webinars. Thanks again for attending today's event, and thank you again, a sincere thanks to all our presenters for all the wonderful information.